We are trying to give a small demo and a few rules which you are supposed to follow for doing a debit card EMI. Okay, how to process it and what are the small rules and regulations for following this debit card, I'll be telling in this video. Okay, you can follow it clearly. Okay, I've written it stepwise in this paper. Okay, you can keep this paper as a reference whenever you want. You can keep this paper as a reference, then you will understand how to go about with it. I'll be explaining each and individual point, as in first, whenever you're starting off with a debit card EMI, first you have to check the eligibility. When a patient is fine with your treatment plan and he wants to use his debit card EMI scheme, first check the eligibility can be checked by a message sending to 56767. Number is easy, 567 and 67 will be repeated again. 56767. To which you have to send a message DCEMI. DC stands for debit card, EMI, space and last 4 digits of your debit card. I'll repeat this point again. You have to send a message to 56767. Continuous numbers of 567 and 67 is repeated again, and you have to send a capital letter DCEMI. DC is debit card, EMI, space and last 4 digits of your debit card. This will be clearly showing a live demonstration again. Simultaneously, when I'll be showing live demonstration, I will tell about these points also. Till second point we are clear. Once you send a message, there might be 2 options. One, you will get a revert message, which will be of 2 categories. One telling it as a regret, and the other can be a congratulation message which shows a pre-approval eligibility amount of some figure. It might be 1 lakh or 2 lakh, 2,50,000, 2,60,000, or it might be 4 lakhs also. So every other patient will be falling in these 2 categories. If they get a regret, they are not eligible to go ahead with the debit card scheme EMI. If they get a congratulations message with some eligibility amount, then you can process the treatment plan for him, and then you can process the debit card EMI scheme for him. But point to be noted at this third point for all the doctors is eligibility of the amount need not be the final amount of our treatment plan. To understand it in a simpler words, if patient is getting a eligibility of 2 lakhs, if we are planning for some aligner treatment, which is 1.99 lakhs, we should not process the thing for 2 lakhs, because there should be a flexibility of nearly 15 to 20% cushion amount which should be left in the eligibility amount. So make it this very simple. If at all the patient is having a eligibility of 1 lakh, you can process the amount till 80,000. But if your estimate is till 120,000, tell patient to pay that 40,000 by some other means. It can be by other debit card, or it can be by other credit card, or it can be by other Bajaj Finance or some other scheme. So to make it very clear, whatever will be the eligibility amount, our amount which can be utilized in it will be 15 to 20% less than the eligibility amount, because this 15 to 20% will be the interest which will be calculated in it. For example, if patient is having a 30,000 estimate and he got an eligibility of 1 lakh, so 4,500 will be his interest amount. So in which clearly 34,500 will be deducted from his account. So this is the smallest and limitest interest which can be taken by any customer for any EMI scheme. If you calculate this, it comes to 1 rupee per month. 1% per month. Generally 2% is the normal charge which will be taken. This comes to 1% charge per month, which is very minimal. That is what we can offer to all our patients. One more thing in it is we are eligible for 3 tenures. One is 6 months tenure, next is 9 months tenure, and the third is 12 months tenure. Whatever tenure you take, the percentage will be same. Okay, so in this point you can tell all your patients that every other patient it is better to go for a 12 months tenure, because even patient will get comfort to clear his amount, okay, without any hurry in clearing the amounts. Okay, the 12 months tenure will be flexible for him to utilize the whole loan amount and clear off with the same interest rate. Okay, and next, okay, if at all patient has so much of eligibility, pre-approved eligibility amount available in his account, okay, there might be probabilities that it might get deducted on the day when you are processing your debit card EMI. Okay, this point has to be underlined and noted by every other doctor. Okay, there might be a clause that there might be a chance that if at all the pre-approved loan amount is available in a client's account, there might be chance that it might get deducted on that day. But please don't worry and don't panic, it will be reverted back within 24 hours. Okay, as we cancel our online booking tickets or online travel tickets, okay, as it will be refunded, a similar way even this will be refunded in 24 hours. Okay, please don't panic, you have to clearly convey this to all your patients. Okay, the first clause is we have to give a flexibility of 15 to 20% cushion to the loan amount. If you are getting a loan amount of 3 lakhs, please don't process the case till 3 lakhs. Okay, you should give a 15 to 20% cushion to the amount. Okay, but if your estimate is costing 3 lakhs, please make it sure very clear to the patient and tell him he has to pay that excess amount in some other means. Might be in a cash, might be in a credit card, or might utilize a Bajaj Finance scheme or other EMI schemes also. Okay, in some cases for doctors who are there in Hyderabad, okay, if the eligibility amount is nearly 1 lakh, okay, if they want to escalate the amount or increase the amount, they can opt for HDFC paper finance. Okay, that is a different thing. Okay, that I'll tell you in detail in other video. Okay, but I think this is very clear regarding the 15 to 20% cushion on the eligibility loan amount. And next, if at all, if it gets detected also, it will be reversed back within 24 hours. Okay, this is very much important. Please do convey this to all your patients. Okay, next, there might be a case in which it is showing a congratulation message of pre-approved loan and so, but it cannot be processed. Okay, in those cases, there are 3 scenarios in which it cannot be processed. One might be the patient holding a joint account. Okay, if 2 clients are there holding the same joint account, in those cases we can process the debit card EMI scheme. And if at all a patient is having a RuPay card, okay, see, as in debit card of HDFC, we do have a MasterCard, Mastro, Visa card. Okay, the RuPay card cannot be used for debit card EMI scheme. Okay, only the MasterCard, MasterCard and Visa card can be utilized. And if at all the person has opened his account recently, okay, less than 3 months to 6 months, they can't avail this offer. They might get a congratulation message of pre-approved loan, but it cannot be processed. Okay, kindly do make note of these things. Okay, the first thing, 15 to 20% cushion. If at all amount is deducted, it will be reversed back into the same patient's account within 24 hours. And next, these 3 cases, if at all if you get congratulation message also, a debit card EMI scheme cannot be processed. Okay, and how we are supposed to send this message, I'll be showing a live demonstration, but the process has to be done from a registered mobile number. Okay, so if at all a person is holding a HDFC bank account, okay, they have to send this message from the registered mobile number. If a client is not having his registered mobile number, then he has to give his PAN card details and Aadhaar card details and even the account number and phone number of the registered. So that way we can help using the customer care services. Okay, that I'll be explaining in the other video. Okay, next 2 things what you're supposed to know is, if at all EMI is started before 19th, from next month EMI will be started. If it is processed after 19th, then EMI will be starting in the next month. Okay, so if at all, if I am doing now in this November before 19th, from December EMI will be starting. If I am processing it after November 19th, EMI will be starting in January 2019. Okay, hope these all things are clear. Okay, kindly do save this photo. If you want, you can take a screenshot of this. Okay, kindly keep this safe with you. Okay, now we'll be showing a live demonstration for which three things what is required is the swiping machine, next the debit card of the patient, and his registered mobile number. Okay, as you can see in this, type kariye again, you have to type. Okay, as I told, it's a debit card, it is simple. We'll be sending DC, capital D and capital C, EMI. Okay, as we are going for EMI, and give space and see the last four digits. 5127 is the last four digits. Okay, we'll be sending that 5127 okay message to this thing. As soon as we send, as I told, we will be getting two messages. It might be two messages what we can receive. Okay, just try this thing. Okay, as I told over here, it can be a regret or congratulations message. Okay, either of which you will get. Okay, if at all a patient can get approval, he will get a message like this. As you can see, we have processed it already, showing that congratulations and you are eligible for pre-approval loan of amount 2,30,000 on your debit card. As I told, on whole of some amount, okay, you have to leave a cushion amount of 15 to 20%. If I have a case which I have to process in this till 1.9 lakhs, I can process it easily. Okay, till 1.9 lakhs. Okay, 1,90,000 I can process it in this debit card alone. Okay, if my estimate is 2.5 lakhs, or if at all, if I am going for a full mouth rehabilitation of A category price of 2.99 Lee Valley package, okay, in that case I have to process 1.9 using a debit card scheme, and the rest of the amount has to be collected in a different means. Okay, it can be in a cash or it can be in the other Bajaj form, other Bajaj EMI scheme, or paper finance, anything. Okay, once the patient gets the message, okay, it is a confirmation to you that he got so much of approval. Okay, next to start off with it, okay, as soon as you switch on your swiping machine, what you are supposed to do is first you have to click your green button. Okay, as soon as you click the green button, the multiple options open up. Okay, as you can see, sale is one of the option. Sale is one of the option. These multiple options will open up. Okay, you have to go to this bank EMI option. Okay, bank EMI option, again click on green button. Okay, here the amount whichever you enter to utilize this debit card EMI scheme, the minimal amount is 10,000. It should not be less than 10,000. So I will be just showing you a demonstration for 10,000, which is a minimal amount. Okay, as soon as you do it, this is the 10,000 amount. Okay, then press the green button again. Okay, it asks the invoice number. The invoice number for this already default it is 1234. Okay, then press the green button again. Okay, now have to take the card, insert it. Okay, you can insert it or you can swipe it. Anything is fine. Okay, as soon as you insert, see, it is processing right now. Okay, it will connect to its GPRS system. Okay, see, now it is showing the tenure. Okay, as I have told you over here, okay, we got a pre-approval loan of eligibility so and so. Okay, when we are processing, we will make sure that we will take a cushion of 15 to 20%. And here, as I told you, it is always better to go for 12 months because patient will have some time to clear his amount. So in here, okay, I will be changing my 6 months tenure, 9 months tenure, or 12 months tenure, depending upon whatever is patient opting for. And then next, you have to just run the process by pressing this agreeing button. Okay, continuously if you press go on pressing this green button, right, for next commands, automatically the slip will be generated. Okay, the two slips will be generated. One will be with the patient and one will be with us. Okay, I think it is completely clear. Okay, just I want to just give a brief note on this. Okay, each and every doctor should know is this number, first thing. Okay, SMS number, which is 567, the repeat of 67 again, and as it is a debit card EMI, DC EMI space last 4 digits. and as soon as you get the message, whatever pre-approved loan amount is there, you have to leave a cushion of 15 to 20% to process the debit card EMI. Okay. The next, if at all, by chance, if the amount is there in the account, if it is detected in any of the patient, it will be reverted back in 24 hours. Okay, kindly do make note of this thing. Okay, please don't panic when patient is telling. Okay, kindly do assure them, telling that within 24 hours it will be reverted back into their accounts. Okay, these are few of the scenarios in which it can be declined. Those are a joint account, if the card is RuPay card, if the bank account is recently opened. Okay, this is very clear. If it is before 19th, the EMI will be starting from next month. If it is after 19th, it will start next to next month. Okay, hope all these things are clear. Okay, kindly do utilize it and kindly avail your Diwali offers, and looking forward to meet you all in Goa. Thank you.